Do lymphoma patients have the right to refuse treatment? Do lymphoma patients have the right to refuse treatment? This is an important question that touches on patient rights and medical ethics. Yes, competent adult lymphoma patients generally have the legal and ethical right to refuse medical treatment, including chemotherapy or other standard therapies. This right is grounded in the principle of patient autonomy. It recognizes that individuals have the authority to make decisions about their own bodies and medical care, even if refusing treatment may lead to serious consequences. For competent adults, this means they can accept or refuse any medical treatment after being fully informed about the risks, benefits, and alternatives. Physicians have an ethical obligation to ensure patients understand their prognosis and treatment options. However, they cannot force treatment on a competent adult against their will. This respect for autonomy is a cornerstone of medical ethics. When it comes to minors or adolescents, the situation can be more complex. Courts often intervene to order treatment in life-threatening situations, especially when refusal is based on personal or religious beliefs. Some jurisdictions recognize a concept called mature minor, which allows certain teenagers to have some legal capacity to refuse treatment. There have been cases where teenagers with lymphoma have refused chemotherapy, leading to court orders for treatment despite objections from the patient or their parents. This highlights the state's interest in preserving life. Legal and ethical challenges arise when a lymphoma patient refuses treatment. Healthcare providers must balance respect for a patient's autonomy with their duty to provide care. In cases involving minors or patients deemed incompetent, legal authorities may authorize treatment even against the patient's wishes. For adults, the refusal must be informed and voluntary to be considered valid. Practical considerations are also important. Patients who refuse treatment should be supported with clear communication, psychosocial support, and options for palliative care. Healthcare providers are advised to document discussions thoroughly and may seek legal counsel if there are concerns about a patient's capacity or safety. Additionally, lymphoma patients may face challenges with insurance coverage for treatments. This is a separate issue from a patient's personal refusal. Patients have legal avenues to appeal insurance denials to access necessary lymphoma therapies. In summary, the right to refuse treatment exists primarily for competent adults but is more limited for minors or cases where refusal could endanger life. Patients should receive comprehensive counseling about the consequences of their decisions and be supported in their choices. Healthcare providers must navigate the ethical and legal responsibilities while ensuring that patients understand their options. Personalized medical advice and legal guidance are essential in these situations.